This is Pat Salber with The Doctor Weighs In, and we're going to talk about something we haven't talked about before, and that's alcohol. Not a little sip of wine, but people who actually have an alcohol abuse disorder. And I have with me today John Mendelson, who's a doctor. Actually, we both trained at UCSF, and he has a new company, and I jokingly said it's DXRX. I said, oh, is it DXRX or Dix Rix?
It's DXRX. We're not doing urology. And yes, we both trained at UCSF, and they just got rid of the leeches. They've moved on to more modern techniques since we've been there.
Oh, I'm so glad to hear that. I did take care of somebody who was getting their wound cleaned out with leeches.
Exactly.
So I thought if you could just tell us a little bit, we do write about addiction, but we haven't specifically written much about alcohol. How big a problem is this? Is it a really big problem? It's just a hidden problem? Tell us about it.
Well, alcohol and alcohol use disorder and excessive drinking are the biggest drug problem in the world. It's the biggest drug problem in the world. It's estimated
It's bigger than opioids?
Maybe 100 times bigger than opioids. It's estimated that about 1 in 10 people have a bad relationship with alcohol. And that means that they drink more than they should. They're unable to control their intake. They're unable to stop when they want. And they do things they don't want while drinking. And they have harm from their drinking. Of those 1 in 10 people, it's a progressive problem. So people start in their 30s, and then they really get going. And they get heavy drinking in their 30s, and they progress on in their 40s to having measurable problems with their families, with their work, with legal issues. Virtually, you could say everyone who's had a DUI has a drinking problem, and in the United States and the rest of the world, those problems are largely unaddressed.
And why do you think that is? Are the treatments just not that good?
It's a complicated reason why alcohol hasn't been addressed much in the United States. First, there's a stigma of having a alcohol problem. Second, the recovery community has insisted that abstinence is the only outcome that's meaningful. And there's a lot of data that says that's not the case. For people, for example, people who go into abstinence-based treatment programs, at 5 years, 80% of them are drinking, but drinking less. So it's a problem that can get better and people change on, but abstinence isn't the only pathway.
And don't you think, in a way, I find it interesting because I have had a friend who was abstinent for a long time and really felt kind of the absence of the camaraderie of not, going to the bar and getting, really drunk, but just being able to sit around and have a glass of wine with somebody. So is this a big selling point now to say you don't have to be abstinent and we still can offer you some hope?
Yes, I think it really is. I think actually and what's nice is that for the last 30 years, the National Institute of Alcoholism and Alcohol Abuse and other academic researchers have been searching and finding treatments that allow people to control their alcohol use. So we have lots of studies out there showing that medications can decrease days of heavy drinking in people seeking treatment or decrease heavy drinking days. In other words, they can decrease the number of days per week you drink or decrease how much you drink on a particular day.